We're gonna get started with a little game. We like to call this What's Wrong with This Picture? So I need a few audience volunteers. Do I have any takers? You two look like you want to play the game. Come on up. Come on over here next to me. All right. And what's your names?
I'm Kelsey.
Kelsey, nice to meet you.
Dawn Marie.
Dawn Marie.
Yes.
All right, so what we're gonna do, we're gonna show you a succession of pictures.
Okay.
A couple of them we've, quote unquote, doctored a little bit. We want you to tell us what's wrong with this picture. Take turns alternating what you think it may be. And it could be on the person, it could be on their skin and their hair, anything that you notice that's off in this picture.
Okay.
You
want to go first?
Yeah.
Okay.
I noticed the guy on the right, his skin is kind of oily.
Yes.
Yeah, it is oily.
It is oily. I would say something with his eyes. The guy on the right, his eyes are a little slanted.
Kelsey and Dawn Marie, I'm impressed because you did a great job of analyzing what's going on. And those are all accurate portrayals of what we see there. But there's one thing in particular that we wanted to highlight. And this is doctored, and so it may not be as obvious. But do you notice how the individual on the right has fairly yellow skin?
Yes.
That is not normal.
Okay.
And when I walk into a patient's room, if I notice that they have yellowing of the skin, one of my first concerns is something called jaundice. And what happens is when your red blood cells break down, something called bilirubin is formed.
Okay.
And it can actually, if too much of it builds up, it can make your skin look yellow. That's obviously not a good thing because it means something's going on. It could be that too many red blood cells are getting destroyed, but oftentimes it means there's a problem with your liver or gallbladder because that's how you get rid of and process your bilirubin. But jaundice is never normal in an adult. So if your skin suddenly starts to turn yellow, get it checked out. Are you ready for your second picture?
I'm ready. Okay. The bruising.
Oh, look at you guys.
Bruising.
That's fantastic.
And the
I'd
knees are
pick that
kind of
one
red
up
a little bit
fast.
too.
You guys went straight to it. It
Yes.
is bruising in these pictures. And basically, you know, bruises are caused by you get an injury to the little capillaries underneath your skin, or they're weak for whatever reason. Sometimes this can be anemia, which is one of the causes you would think of, but these are pretty big. So you might also think about clotting disorders, you know, other kinds of things that would affect the things that help your blood clot.
And at least in a young patient like that, maybe medication she's taking, whether she's taking
Absolutely,
a lot
even
of aspirin,
as simple
anything
as aspirin.
that's going to
That's what I've
affect
heard.
platelets.
She's taking too much aspirin or like corticosteroids or things like that. So anytime you have unexplained bruising that just kind of comes up,
I get
then you
that.
have to kind
I
of
do, a
question if you
lot.
don't remember, like
Exactly.
you know, knocking into a table or something like that. It could be a sign of an underlying condition or of medications that you're taking that may be thinning your blood out too much.
All right.
So the
Thank
first
you.
two pictures,
Yes.
you should probably go see a doctor, get blood tests, figure out if there's something underlying that problem. Are you all ready for number 3?
Ready.
Okay.
Let's pull it up and see, what do you think this picture is
I can go.
telling you?
Okay.
The son, the baby, his eyes are kind of slanted.
Eye is
They're kind of like
inverted.
wandering, inverted into the other eye.
You are
You got that. You haven't seen these before. Wow.
This is great. Actually, as a pediatrician, we actually diagnose this from family pictures a lot. And we see, if we see the wandering eye or the cross eyes, we call this strabismus, and it's when both eyes aren't looking in the same direction. And it's important because the wandering eye is sending a different signal to the brain visually, and it will get ignored. And after a while, that eye just gets shut off from the brain and is essentially blind unless it's fixed. So that's why we need to address this pretty quickly in a child within, you know, certainly within the first year of life. Oftentimes just patching the good eye to let the weak eye build up its muscles, or sometimes special glasses can help. And if that doesn't do it, then a pretty simple surgery is the fix.
You two are so perceptive. Thank you
Okay.
both so very
Thank
much.
you.
Kelsey
Thank you.
and Dawn Marie, fabulous job.